superstitions. Thank you. So Sutradhar is the one who spins the whole narrative, and that's her role in this whole.
Viewers who have joined us online, I truly appreciate your taking out time to come and listen to this story that we have to tell. Young colleagues from the cadre around the table, all the officials of UNICEF Delhi as well as UNICEF Mumbai who have taken out time to be here. So what is the Kumbh? I'll start from there. So as you know, you would have definitely heard the word Kumbh.
Kumbh Mela is the world's largest religious gathering. Millions gather from all over India and outside in search of divine blessings. In 2015, when Nasik's turn came to host the festival again, the administrators decided to face the mammoth challenges of organizing Kumbh with much grit.
It's going to be a huge mammoth task. And especially because in public health, the entire responsibility of the welfare of the people who are coming in such large numbers from all over the country is on your shoulders.
Their motto was to save every single life and make the festival a pleasant one for all the pilgrims and visitors alike. Of course, this was anything but easy. Not only the event creates serious and uncommon public health challenges, Nashik also adds to the worries with its unique problems. Organized in the heart of a city, Nashik Kumbh holds the record of having largest public gathering in smallest possible area, which is held in two different cities simultaneously, Nashik and Trimbakeshwar. Rainy season further heightens the risk of infection and accidents.
And the state at that time is on its highest alert, especially all the public health institutions, because with rain comes a lot of spread of infectious diseases and waterborne diseases.
Considering all this and more, preparing the health sector for a mass gathering like this was indeed a Herculean task. The Public Operation and Collector's Office Nashik implemented a strategic and company remained vulnerable. How to check epidemic? Historically, disease surveillance would entail manual data collection, and a huge amount of paperwork can significantly slow up disease detection. The need of the hour was to put in place some kind of real-time surveillance system that will help in taking quick decision and prevent any epidemic-like situation going out of control. Collaborated with Harvard University SAI and UNICEF, implemented the Janashastha project. The cornerstone of this project was a large-scale API-based disease surveillance program called the M-Counter.
So syndromic surveillance entails looking for a cluster of signs or symptoms presenting to the clinics.
The project was tested in a limited capacity during 2013 Allahabad Kumbh Mela. Gaining experience with Harvard's extensive research there, the M-Counter was redeployed in 2015 at Nashik Kumbh.
The system that we institute in Nashik was not parallel to what the government was doing, but that it is integrated into health systems.
My first thoughts were that this is some kind of an academic / research exercise, and whether we will be able to handle this in addition to everything else that we had to do. Then slowly, as we had that communication with each other, and as I understood more and more how this whole thing is going to play out, we agreed to do it.
Public Health Department Maharashtra with Harvard SAI team organized a 3-day training programs for the entire crew of medical personnel to ensure an effective healthcare service during the Mela. The third day of in its scale. A whopping 35 of the 56 health units in the Mela area were equipped with EM counter installed tablet computers.
In Nashik and Trimbakeshwar, multiple clinics were set up along the routes at which the pilgrims would come to the bathing sites.
This helped in checking any contagious disease entering the Mela.
Trying to track the patient flow and what kind of diseases are they coming in with, tracking them for whether they are coming for a follow-up visit.
100 doctors were trained for 2 months regarding the operation of EM counter to make them comfortable using the system. A team of 12 researchers from the Harvard site were kept on site at all times for training, monitoring and support. Medical students from across the country volunteered round the clock in the project.
So we had roving teams of 2 or 3 who had to cover every single clinic, and I think we had covered the 38 busiest clinics out of the 55.
Doctors in these units entered few basic information such as age, gender, location, chief complaint and diagnosis in the digital form. This information was enough for the purpose of disease surveillance. Collected information from all units automatically got uploaded in cloud server and generated easy to understand graphs and charts on a remotely accessible password protected dashboard.
It was not a static image, it was a dynamic tool that could be interrogated. As you click through various parts of the graph, it readjusts to give you more information.
The project became one of the largest successful health information systems rollout anywhere. In all, the medical officers entered a staggering 36,343 entries in 9 days of clinic operation, averaging over 4,000 entries per day. It did serve its purpose as the government officials quickly adapted the system.
There was actually ground level action that was taken based on this information.
The local health administrators noticed a spike in gastroenteritis and just presentations of upset tummies and diarrhea. They interrogated the dashboard. They found that oddly the majority of those were being reported at this one particular clinic.
The management can understand within a second that at this spot there are the many patients of diarrhea. It may have the problem in water and food. They came there and tried to solve it.
There is always a need to test health interventions to improve public health and safety. Kumbh Mela, owing to its predictable unpredictables, provided an excellent opportunity to that end.
So for the first time in India, we had real-time syndromic disease surveillance available at the fingertips of all these policymakers.
This is a layer of the fever. How many patients of diarrhea? In which area exactly what infection is on?
Where each and every patient they see gets entered into a common database so that preventive steps could be initiated in a very swift way.
And that is the beauty of this whole exercise, and perhaps that is where we are hoping that it would be useful for people in the future.
The way EM counter was adapted and the response it generated goes on to show that India is ready for widespread mobile health intervention. The other component of the Janashastra project was a mass screening program for oral health, hypertension and diabetes offered to pilgrims, sadhus, security forces and residents of Nashik Trimbakeshwar. A total of 1.85 lakh patients were treated during the Kumbh Mela.
We treat every patient who comes in as a client who has to go back completely satisfied.
So I think we have a tool that is ready to be deployed for mass gatherings anywhere. It's easy to use, it's low resource, it integrates well with existing health systems.
It has relevance to how major congregations happen. It's going to be a marked shift from the way things have been working and to the way things can happen tomorrow.
At a stage as big as Kumbh, it is an understatement to say that this was an outstanding achievement.